Governor Eric Holcomb wants to make Indiana the best in the Midwest as he seeks to decrease infant mortality by 2024.
Local hospitals are working to reach this goal. That's because right now, Indiana sits in the top 10 states with the worst infant mortality rates. Shelby Riley caught up with health leaders here at home to see how close we are to reaching the goal.
To start off, infant mortality is defined as the death of a baby before his or her first birthday. According to a report put out by the Indiana Department of Health, in 2020, the state of Indiana had 6.6 infant deaths for every 1,000 live births. The nation's average in 2020 was 5.4. To put that into perspective, that means 522 Hoosier babies died before their first birthday in 2020. That's nearly 44 babies every month and about 10 babies every week. Staff with Union and Good Samaritan Hospital say although we have seen a decline over the last few years, we are still much higher than most states, and there's still work to be done.
We know here in Indiana we're the 7th highest in the U.S. and that the governor has put a goal for us to be the best in the Midwest by 2024.
The state of Indiana has lost over 2,800 infant lives in the past 5 years. That's more than 39 school buses at maximum capacity.
And over 50% of those cases are due to what we call perinatal risk factors. Perinatal risk factors are those things that you and I can hopefully control a little bit.
Dr. Mary Abernathy with Union Hospital says they are trying to implement safety and prevention methods before the baby is even born, because usually a healthier mom equals a healthier baby.
Such as getting women into care early, making sure that if they have diabetes or hypertension before pregnancy, that they get those into the best optimal care, get them at the optimal weight.
Madeline Taylor, nurse manager of the OB department at Good Samaritan Hospital, says most of the deaths come from those perinatal risk factors, specifically unsafe sleep practices.
The Academy of Pediatrics just came out in June with new recommendations with that. So some big changes to that were no hats on babies while they're sleeping after they're discharged home.
She also says no heavy blankets or pillows in the baby's sleep space, and the only thing they should have is a fitted sheet. Taylor says there are changes they have to make at the hospital to implement sleep safety, such as changing their bassinets that have an incline.
The Safety Commission is looking at disbanding all products that have a 10% incline or more. So they really are looking at how a baby can't support their head right after for at least around 6 months. So that incline can cause them to block off their airway if they're asleep and their head falls forward.
Good Samaritan Hospital has a safety pin program, or Protecting Indiana's Newborns, to help lower the infant mortality rate. This helps give mothers resources ahead of the baby being born.
Something we see a lot in our program, which is the safety pin program, is just access to care, especially prenatally. So our physicians have done a really good job making referrals to our program as early in pregnancy as possible.
Dr. Abernathy says Union Hospital has perinatal navigators to help give mothers resources if they need help with things like transportation to appointments, food, or housing. Now, back in 2011, Indiana's infant mortality rate was a 7.7, so there has been an overall decrease in the last decade. But both Union and Good Samaritan Hospital say they feel like Indiana is on the right track to reaching Governor Holcomb's goal by 2024.